In today's session, we're going to look at our NF renal function diets. My name is Laura Hughes and I'm the Nurse Development Manager at Purina. So as a bit of a recap, first of all, we're going to look at normal kidney function. Within the kidneys, you have the nephrons, which are the functional units of the kidney. Blood vessels from the body go into the glomerulus, and this is where the filtration starts. And waste products are excreted through the bladder. So as I mentioned, the main job of the kidneys is to act as a filtration system. But it also has a variety of other functions, including maintaining fluid balance within the body, regulating phosphorus levels, maintaining the body's pH, so slightly acidic, and producing hormones, specifically renin, which helps with blood pressure, erythropoietin, which produces red blood cells, and converting vitamin D to an active form, which supports calcium-phosphorus balance. Now we'll move on to talk about chronic kidney disease. When we are talking about the disease, we will refer to it as chronic kidney disease. But when we are talking about nutrition, it will be in relation to supporting chronic renal insufficiency. We know that there are lots of causes of chronic kidney disease, from infection, toxins, high blood pressure, but for the majority of cases, it will be idiopathic, so an unknown cause. When diagnosing chronic kidney disease, you would consider multiple parameters, including urine testing, looking at concentration and protein in the urine, and blood tests, specifically looking at SDMA, urea, and creatinine. There are also other parameters that you may review, such as FGF23, and these are sometimes being used within practice now. So, what are the clinical signs of chronic kidney disease? Well, the most common ones that we tend to see are the polyuria and polydipsia, but we also see things like inappetence, vomiting, and many, many more as the disease progresses and as the kidney function is further lost. So the consequences of chronic kidney disease are significant. You can see a build-up of waste products. You will get high phosphorus levels in the blood. You will get a reduced ability to concentrate the urine. You will have lower red blood cell counts due to the lack of that hormone erythropoietin. You will have protein in the urine due to the renal damage and potentially high blood pressure as well. Now, you may be aware of the IRIS staging, which is the International Renal Interest Society. And this chart here allows you to stage the level of kidney disease in order to then treat appropriately. The next stage of their guidance is then to look at what is the recommendation for treatment at each stage, and this then gives you some detailed information about what you would be considering at each stage as the condition progresses for this animal. So when we look at IRIS staging, there's a few things that I'd like to mention. So when we think about kind of what happens and what do we see within practice, clinical signs do not normally appear until the end of stage 2 and early stage 3. But when we look at the progression of the disease, by the time the animal is at the end of stage 2, they've already lost about 66% of their kidney function. And by the time they get to stage 3, where we would definitely be seeing those clinical signs, 75% of that kidney function has been lost. When we look at kidney diets, there are nutrients that we will specifically focus on to support these patients and slow down the progression of that disease. So we will look at phosphorus restriction to slow the progression of the disease, protein restriction so that we can minimise those nitrogenous waste products that can lead to nausea and inappetence, reduced sodium to help control blood pressure, increased potassium to compensate for the loss in urine, increased omega-3 fatty acids to reduce glomerular inflammation, increased B vitamins to help replace those that are being lost with polyuria, antioxidants to mop up free radicals that would be damaging the kidneys, and we want to make sure this diet is non-acidifying, as acidosis is common in patients with chronic renal insufficiency. So now let's look at our canine product. So this is for our dogs with chronic renal insufficiency at stage 2 and above, and can also be used for some urolith types and comes in both wet and dry formats. So this diet works by having lower levels of phosphorus to slow the progression of the disease, restricted but high quality proteins to maintain muscle mass but limit toxin formation, and the omega-3 fatty acids to support inflammation. Some of the other benefits of this diet are that it's a non-acidifying diet to help minimise metabolic acidosis. It helps to manage calcium oxalate by having a lower calcium and vitamin D3 levels, which then produce a neutral urinary pH between 6.7 and 7.5. The dry product can also support the reduction of urate due to low purine levels and high quality proteins. The dry product can also reduce cysteine due to moderate levels of sulfur, and it contains alkalizing properties and low levels of high quality protein, and then it's highly palatable to support compliance. So this is our typical analysis for the canine wet and dry products should you need it. This is also available in our veterinary product guide and our technical information on the Veterinary Centre website. So let's explore the main 3 nutrients that we talk about within this diet that support dogs with renal insufficiency. So first of all, we're going to look at restricted phosphorus content because we want to slow down the progression of the disease, and we do that by lowering the phosphorus content in the diet to support that glomerular filtration. We want controlled but high quality protein. We want to reduce the amount of nitrogenous waste and uremic toxins, which will make the animals suffer with nausea and inappetence, but whilst maintaining that lean body mass, because we know that if we restrict the protein too much, the body will catabolize the muscle, which then will have a greater impact on morbidity. We want to increase those omega-3 fatty acids to support the inflammation in the kidneys. It also reduces that glomerular pressure and increases the glomerular filtration rate as well. Okay, so we'll now go on to our cat range. So as we mentioned earlier, clinical signs are not seen until the end of iris stage 2, early stage 3, and therefore for our senior cats, we want to consider screening them often, detecting it early, and supporting them with nutrition. Now, currently, around 11% of cats are diagnosed through routine screening rather than presenting at the clinic with clinical signs. So with this in mind, we have an early care renal product for iris stages 1 and 2, and we have an advanced care product for iris stages 3 and 4. Both of these ranges come in both wet and dry formats. So let's start with our early care product. So predominantly, we're looking at a very similar approach in dogs in relation as dogs in relation to the nutrients that we're adapting. So we're looking at having moderate but high quality protein, restricted phosphorus, and our omega-3 fatty acids, potassium, and antioxidants. Additionally, we also look at it being highly palatable. We have those added B vitamins to compensate for those that are being lost during polyuria. We've got added potassium to reduce the risk of hyperkalemia. We've got omega-3 fatty acids to reduce glomerular hypertension. And we've got sources of fibre to promote good fecal quality. Now, this is our typical analysis for the feline wet and dry products, should you need it. But again, if you want to see another copy of it, you can always go onto our Vet Centre website or any of the packages themselves. So let's explore the main nutrients that support cats with chronic renal insufficiency. So we know that a cat's preferred energy source is protein, and within this diet, it's about striking a balance. We want there to be enough protein to support muscle mass, but not so much that you are getting lots of nitrogenous waste products. We want to help slow down the progression of the disease, so we want to lower the phosphorus content within the diet to help support that glomerular filtration. And then we have a blend of nutrients within the product that have been shown to support the survival time in these cats by up to about a year. Okay, so now let's look at the advanced care product. So as I've already mentioned, this is designed for your cats at iris stages 3 and 4. Now, within the advanced care product, we further restrict the protein within the diet, we further increase the omega-3 fatty acids, and we have a variety of textures and flavours to help encourage the cats that have a reduced appetite due to the increase in the clinical signs associated with the kidney disease. Now, the additional nutrients that we're adjusting within this product are we have further dietary phosphorus restriction. We have added potassium to reduce that hyperkalemia. We have added B vitamins to replace those that are being lost through polyuria. And we have it as a highly digestible diet because we know that cats with chronic renal insufficiency will often have a compromised GI function. So this is the typical analysis that we have for our feline advanced care product in both the wet and the dry formulas. And again, this is also available on our Vet Centre website or within our veterinary product guide manual. So as more of the kidney function is lost and this condition progresses through the iris stages, we know that the animal may start to feel more unwell and will show further clinical signs. And that's why we want to focus on 3 specific areas. So we want to make sure there is enough protein to support muscle mass, but not so much so that you're getting lots of nitrogenous waste products. We want to slow down the progression of the disease by having a lower phosphorus content within the diet to support that glomerular filtration rate. We want to have increased omega-3 fatty acids to support the inflammation within the kidney, which also reduces glomerular pressure and increases the glomerular filtration rate. And then another benefit of the advanced care is that we have the dry product, 2 flavours of pouch and a tinned product as well. The tinned product is a coarse pate type consistency. And as we understand that the kidney function is lost, that can lead to them feeling unwell and therefore not wanting to eat a diet that they've been happily eating before. So they develop an aversion to it because they link that it could be that diet that's associated to why they're feeling poorly. Often you'd find with these cases, if you move them to a different flavour within the range or a different format within the range, they will accept that and then they will eventually go back to the one that they were originally eating. It is worth just noting that if you have cats that do have a texture preference for a more uniform consistency of a wet product, but is at iris stages 1 or 2, they could still be fed the tinned product as it meets the nutritional product PARNOT that is there for chronic kidney disease. So over the next 2 slides, I'm going to show you the differences that I've already touched on within the previous slides, but in a picture form so you can see what happens to a certain nutrient in the early versus the advanced care product. And as I say, this is not going through anything that I haven't already touched on in the earlier slides. It's just giving you a different visual representation so you can see the differences versus the early and the advanced and the areas that are the same in between. And again, we've got a different version of it here, just really showing you kind of, if you think about sort of from an early phosphorus restriction to help slow the progression of chronic renal insufficiency. We've got moderate high quality proteins to reduce nitrogenous waste. We've got added omega-3 fatty acids and added potassium and sodium. But then when we go to the advanced, we're doing further phosphorus restriction to help reduce and slow the progression. We're further restricting those high quality proteins to reduce the nitrogenous waste. We have a higher fat content to help maintain their lean body mass, but also to help from a palatability point of view. We have omega-3 fatty acids as a natural anti-inflammatory, and we have added potassium and low sodium. It's also a more energy dense diet to help maintain their body weight, because that we know that for some of these patients, they may not be feeling great. So we want to try and get as much in as we can. The key to ensure these patients accept the diet and eat it consistently is to get it diagnosed early before their appetite starts to be affected as a consequence of the uremic toxins. The biological value of the protein, including the complete amino acid profile and high protein digestibility, is also key to maintaining lean muscle mass and maintaining their body weight at all stages of chronic renal insufficiency. So I just wanted to highlight one of the resources that we have to support cats with dietary transition. So we all know kind of how challenging sometimes it can be to get cats to change their diet, but this is an information sheet that we have that you can share with clients that really helps them about thinking about how to introduce this diet, but also that it may take some time because we know some of these cats can be a little bit tricky. So, thank you ever so much for your time and attention for today's training presentation. If you have any questions at all or any queries, please reach out to vettechline@purina.nestle.com. This is an email address you can also use if you have those technical cases where maybe they have multiple conditions that contradict each other from a nutritional perspective and you don't know which way to go and are looking for some support with the recommendation. Please send us through the details and histories, and we can review that for you and help you to make a dietary recommendation. Have a great day and thank you so much for your time and attention.